All right, just an old nurse. This is part 2 of my weight loss journey. I have my coffee now. So after I lost all that weight with phentermine and gained it back, I decided I would try walking it off because, again, very active person. So I thought, well, I'm just going to walk, and try to eat better. And so I started walking, ended up getting into half marathons, and was very active. I don't remember my weight during that time, but it kind of went up and down. I'm guessing I was anywhere between 170 and 180, somewhere in there. I'm very influenced by people's testimonies. If they tried something that worked for them, all right, I'm gonna try it. I had been scared of traditional weight loss surgery, although many around me had great success. We would see the patients in the ER that did not have great success or complications. So it was kind of scary. So I wasn't really willing to go that route for myself. And so that really was never on the table for me at that time. So then I had a coworker. I don't remember the sequence of events totally, but in around the same time, I had a coworker start on a program called Calibrate, and then also a coworker who had liposuction. So I kind of did this all around the same time. This was like May of 22. And I'm going to post some pictures. Put that out there. It's hard. So I had the liposuction done in May of 22. And it went fine. There was a little pocket of skin up higher right under my sternum that he couldn't get to. So there was kind of a pocket of skin there. But anyway, so I had that done and I started on Calibrate. Calibrate I signed up for a year, and it was you had a coach, you had a meal plan as far as what types of foods to eat, not specific foods, and then lots of water and a modest exercise program, and then also weighing daily. And the scale was supposed to upload. It never did upload very well or consistently. So, but anyway, it was a good program. It was awkward talking to someone every other week about my food and my weight and that sort of thing. But I thought the approach was a good approach, and they also guaranteed, due to my lab work, my cholesterol was just above normal. So due to my lab work, my insurance paid for Ozempic. And so with this program and that lab work, I was guaranteed Ozempic for $50 a pen, which, as everyone knows, is a steal. And then there was also, throughout that year, there was like a order mix-up, so I had to switch pharmacies. And anyway, ended up getting about 2 years worth of pens at like this $50 price for whatever reason. So that part worked out. But there were a lot of side effects, but I didn't do too bad with the side effects. Some nausea, some constipation, some cramping. But, sometimes I see patients in severe abdominal distress due to a GLP-1. So I was very fortunate. And I knew there were other kinds out there that supposedly worked better, but this was modest in price, $50 a pen, and I was doing okay on it, so I was pleased with those results. And I think I probably got down maybe to 165, 170, and kind of stayed there. And I have really utilized that meal plan, or tried to. Sugar is always an issue, but so I kind of stayed with that meal plan, even though I went off after 1 year. I stopped having all the other benefits that the being a part of the program offered. And I'm going to stop right there for part 3.